Hi there, so today I want to talk a little bit about blood tests and what they can reveal about the cause of your hair loss. So when you're looking into hair loss, blood tests can be crucial in terms of providing an insight as to the reason for the hair loss, and once we know what that is, we can successfully reverse it. And they can be really helpful for women, especially who are struggling with hormonal issues. For example, irregular cycles and thinning hair could indicate polycystic ovaries, which affects roughly 1 in 10 women in the UK. For women approaching perimenopause or menopause, hormonal changes can also lead to hair shedding and thinning. Another common cause of hair loss is thyroid disorders. The thyroid's a gland that just sits here in your neck, and I like to think of it as the boiler of the body. So if it's working too hard or not hard enough, it can disrupt your hair's growth cycle, leading to hair loss amongst many other symptoms. And lastly, what's really helpful to know is whether you've got any vitamin deficiencies, because they can play a big role. If you've got a low level of zinc, iron or vitamin D, it can all trigger shedding or thinning hair. And by knowing what's low, and more importantly how low, you can then decide what dose you need and for how long with your doctor. So by identifying these underlying factors and others, we can then create a tailored plan to tackle the root cause, which saves you kind of months of trial and error. Blood tests are fairly simple to do and can be added onto consultations, and they just give you that bit of control back as to what's going on.